Hello, I am Marwan Abourass. This presentation is your introduction to one of the most clinically transformative tools in modern dental diagnosis, specifically endodontics. It's called the 10 Areas of Diagnostic Interest, 10 ADI protocol. A radiographic analysis system developed as part of my 4R operational diagnosis protocol. Every day, we clinicians review periapical and bite-wing radiographs, often scanning for noticeable lesions, defective restorations, or inadequate endodontic treatments. But how often do we look systematically? How often do we ask ourselves, have I truly examined every anatomical or pathological clue in this image? That's the purpose of the 10 ADI. The purpose is to give you a structured, repeatable, biologically focused method for analyzing every diagnostic radiograph, specifically the periapical and bite-wing. And we do that so no disease or defect is overlooked. The 10 ADI are arranged from the clinical crown to the apex and back to the adjacent teeth. The tooth and its supporting structure. Each ADI is not just a location or anatomic landmark. It's a zone of a clinical significance. ADI 1, the clinical crown, where everything starts. ADI 2 is the pulp chamber. 3, the root canal proper. 4, the root apex. 5 and 6, the lamina dura and the periodontal ligament space. Most neglected diagnostics in dentistry. 7, the periapical bone. 8, the periradicular bone. 9, the alveolar bone crest. 10, the adjacency, the adjacent teeth, anatomical and problems and treatments. Each of these zones carries its own diagnostic value, treatment implications, and potential misinterpretation if it is overlooked. The 10 ADI was developed as a foundational structure of the 4R operational diagnosis protocols for endodontics, periodontics, and restorative dentistry. It requires more than rushed diagnosis looking at the radiograph. It was needed for a structured protocol based on evidence, diagnostic radiology, and best practices in our specialties. The 10 ADI is a philosophy of care, okay? It really reflects my philosophy. Its purpose to train not only your eyes, but your mind to think diagnostically, operate operationally, and treat with a complete understanding of the tooth story, the patient's story, from enamel all the way to the apical bone, periapical bone, and beyond. You will see that each ADI has its profile. It's a pathological profile, and its role in guiding your diagnosis and treatment, whether it's an access, design, or work length, or instrumentation size. ADI is not an academic theory. It's a clinical reality. So before we explore each ADI in depth, remember this. The power of a radiograph lies not in what it shows, but in how we choose to interpret it. With the 10 ADI protocol, trust me, if you do enough, by it, you will no longer guess, but you will diagnose systematically and plan biologically and treat with precision. Let's begin the journey together, okay? This is just an introduction. And we're gonna start with ADI 1, the clinical crown, when everything starts. Thank you.